therapy. I'm Noah Levine, Editorial Director of Dental Products Report and Dental Practice Management. Joining me as always is Mike Massotto. He's the founder of Dental Coaching on Demand and Staff Driven Dental. He's our dental coach and he's here to help us solve problems in dental practices over the next half hour. Mike, as always, thanks for joining us.
Thanks, Noah. I appreciate it. Let's rock and roll. What do we got for you? What do you got today? How can I help?
Well, today's problem we want to deal with is how do you get the team to be on the same page when they're talking to patients, especially when we're looking at, presenting treatment options and things that really require more than one member of the dental team to interact with the patient.
Right.
Sometimes, patients don't want to talk to the doctor. They want to talk to their hygienist about these things, but you got to make sure that the hygienist is going to give the same answers you would as the doctor. So when you approach these, kind of teamwork challenges, what do you start with? How do you get a practice getting on the same page?
Yeah. Well, I don't want to be cliche and use a political quote, but it takes a team to sell a case, basically. And so let's start with some foundational things. And the first thing you need to realize is that the number one lacking system in a dental practice, this is universal everywhere I go, is lack of an effective sales system. All right, and that's the main system I see that's out that needs to be put in, because we don't think about selling in dentistry as something we need to be doing, and yet that's what's going on all the time. We're in a selling environment, and people have to understand that it's okay. Doctors understand and staff that it's okay to sell, because selling gets a bad rap, right? It's a dirty word, it's a four-letter word. We can't say the word sell when it comes to dentistry, God forbid. Interesting thing about sales, right? We all would say, how many people like to be sold? And you raise your hand, and no one raises their hand. I said, how many people like to buy? Everybody raises their hand. We don't like to buy, but we hate to be sold. But the truth of the matter is, you ain't buying if someone's not selling, right? So the truth of the matter is, at all times, buying decisions are being made in the practice at all times, whether it's in hygiene, whether it's when someone calls the office for the first time and what they hear on the phone, when they walk to the front door, the experience they have when they walk in the office, the interaction with other staff in the practice, okay? They're making the buying decisions. Do they meet the doctor for the first time? Do I like the way this guy looks or how she treats me? Does she seem she cares? Do I trust this person? Do I like this person? Do I believe this person? And by the way, I hit on the big three right there. You're not selling anything in your practice. These are the top three things I always speak about. But a patient, in order to buy from you, first has to trust you, right? You ever buy any, and then they have to believe you, like they actually know that you're certain of what you're talking about. You're not just selling them a bill of goods and, well, it could be this or it could be that, like the wishy-washy approach to presenting something, right? And they have to like you, and we don't want discount likiness, right? When's the last time you bought something from someone you don't like? Think about that for a second. Okay, it doesn't take long to figure that out. You don't like someone, you ain't buying them. I don't care how good a dentist you are, or whatever. I don't like that assistant. I don't like that front desk person over there, or whatever. That kills more sales than anything. It's not the money, right? It's do they like the person that they're dealing with? They want to spend money. Do I like this practice, right? And if they like the place, they like you and your team, they're more likely to buy from you, right? So we just discount that and we assume that fatal assumption we make is that everybody loves us. Okay. Oh yeah, they all love us here. We're great. We're special. In our dental practice. No, you're the next person on the hit parade. It's only a matter of time before they stop not liking you anymore. And go on to somewhere else. If they like you that much, every time their insurance changed, it wouldn't come to you and say, "I need to drop you like a hot rock." I got my insurance just changed, doc. And I can go down the street and get it $50 cheaper. Just like that, and they're gone. And then you realize that in that moment, oh my God, my whole relationship with these people was based on money. And not a bond, like, this is like, oh, my dental home, I would never leave you, and truthfully, the best doctors you can go to, if you think about it, for those of you that are watching this, you go back to them, like I say, it's a pediatrician. If you have kids and you're watching this, why do you have kids now, right?
Yep.
Your wife takes your kids to the pediatrician and you go there because why? Because you like the pediatrician and your kids like the doctor. You don't go, well, look at the medical school they went to, look at the plaque on the wall over there, and all that kind of stuff, and look at all those diplomas. And nothing to do with that, it's really, how much you enjoy and like the team and how much they take care of you, right? So that's a big part of selling, so it starts with a group team agreement on having an effective sales system put in place, and that sales system starts from the first phone call, when a new patient calls a practice, what's the intake process when someone calls the office the first time inquiring and say, hey, I'd like to come in for an appointment? There needs to be some kind of scripting there to first, qualify. Is this a new patient and not a returning patient to the practice? You don't want to insult someone and say, when you look acting like you don't even know who they are. When they come in there, say, well, I'm a patient. First you want to clarify that you know who they are and qualify them, but also see if they're a fit for the practice. Because a lot of us don't think that way. That we sort of, they're a new patient. We're so excited and we're so quickly to get them scheduled. Well, do we qualify them to see if they're a fit? Are we going to have a chance to sell them on anything when they come into the practice? And because a lot of us practices are selling price, unfortunately, and we don't want to be in an area where we're selling price, right? And that's a niche you don't want to be doing. Most people listening to me are not running clinics, and you're never going to be able to compete in that niche trying to lower the price below your competitors, because there's always going to be someone cheaper that'll do it for cut rate prices, and whatever the insurance takes or whatever. So you don't want to occupy, that rung of the ladder when it comes to that kind of stuff. You want to basically be the higher end. So you're never going to have the lowest prices in town. Right? And that's part of the sales process. When someone calls and they hit you with, hey, what insurance do you take? You ever notice that right now? That's practice. Ring, 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 hi, smile design center. Yes. Do you take Aetna? It's not even hello anymore. It used to be, and on we go. It's like the immediate debate about insurance starts right from there about everything. So how well we sell them on our how we handle insurance or lack thereof, that's also part of the process. So having some kind of new patient intake is part of the system, right? To qualify them and orient them and set expectations of what's going to happen when they come in. That sales process starts right there. So your team can make or break you at the front desk anywhere. But that's the first part of the sales system. And then what happens when they get there? And what process are we taking the patient through when they come into your practice? What's happening for every step of the way? Who are they seeing? Who are they spending time with? Right? There should be training for that, right? I mean, you're tracking with what I'm saying about the importance of that.
Mm-hmm. Yeah, and it sounds like you've used the word sales and sell a lot, which is what dental practices do and have to do. But a lot of doctors feel like, I'm a healthcare provider, sales should have nothing to do with this. I should be able to diagnose, and then the patient should say, oh, great, that sounds like a great way to solve my problem. But we all know the reality is patients tend to think with their wallets first, and especially on the dental side, where their coverage, if they have dental coverage, isn't going to foot the full bill the same way, same percentage as their medical care. So if dentists already have a higher hurdle with patients on the financial side, do they kind of need to think about it in a sales framework in a realistic sense, or can they just focus on the healthcare and hope that patients see the value of taking care of themselves?
Well, you hit on something that's really, if you think about it, remarkable. That people, let's take America, for example. Those of you watching this in America, in our healthcare system, it has to be a buying decision. It's not about how many times have you heard, what's the old expression, what's the most valuable thing in the world you have? Right? What is it? If you ask him, what's the most valuable thing in the world you have? My health is the most valuable important thing. And then when you're older, you hear your old relatives when they get together, Jewish relatives and Italian relatives are great. They like, right, Noah, but they're almost the same. They'll bemoan the fact about, right, about how their health, they only have my health, right? Yeah. Noah, don't get like me, when you get to that age, that kind of stuff, right? You hear the mantra. I said, okay, but if you just took care of your health and spent the money, invested the time, you would be okay. But it's when it's gone, it's too late, right? Just like your teeth, you just don't go to the dentist your whole life and expect a miracle. What are you going to do? But unfortunately, we have a healthcare system that's based on get insurance. That we have a third party we have to go through making decisions about our healthcare, and it's all in the financial element, which is massive, unfortunately, in the country that we operate in. And so people have to, unfortunately, there has to be a sales process. It should be automatic. I have disease in my mouth. I have to treat some disease, and I have a failing, a situation going on. All right, great. Then how do I do this? Let's go. But it's not like that. So that's part of what we have to overcome and remember, and to educate people. Part of the sales process is to motivate them to say, look, looking at them, having them see the value of their health, and maintaining their health, and do preventative care. What's it going to cost them later on if they don't do this? Look around. And truthfully, the statistics will tell you that of all industrialized nations in the world, just speaking about this the other night, I don't know about tonight, of all industrialized nations in the world, the United States is dead last in health. Think about that. We are on the World Health Index. We are the last. We have all industrialized nations. That's advanced. We are last in the world in health. Yet we have more doctors, we have more hospitals, and we have more people in them than the entire rest of the world put together, which is insane if you think about that. Okay, and what we have there, and and 70% of the planet's medication drugs are consumed by this country. 70%. So there's 7 billion people. So 70% of the world's drugs. That's incredible. And you think for all of that, we'd be healthy, right? But we're not. All right. There's a fallacy to believe that, oh, we have the best system in the healthcare system. No, we don't have that. We have a disease care system. No one goes to the doctor and says, hey, I'm healthy. I want to stay that way. How do you help me? Or look what it costs to go to a dentist to maintain and do preventative work. That kind of thing, when it should be automatic to avoid costs later on. Right.
Yep.
So unfortunately, we're up against a difficult mentality. And you have to have people have a paradigm shift a lot when it comes to health, and your team should be able to do that. And the doctor should be able to do that. And don't assume just because someone's in your chair or they made it into your office, they want to be healthy. This is a fatal mistake. The doctors, well, they're in my office. They must want dentistry. They actually must want to get treated. No, they don't necessarily. No, their goal is to get out of pain or get out, do as little care as possible and get the hell out of your office. That's what they want to do for the most part. We need to have some enlightenment about the value and the importance of maintaining their health or oral health, how it systemically connects to the rest of their body. That's a selling point, right? Mm-hmm. Demonstrating them and showing to them what's happening to their health. We have great tools today, like intraoral cameras and so many other diagnostic tools to demonstrate and show them. Look, using a microscope. I know the office used to use microscopes to put that bacteria under the microscope and show them, like, oh my God, what's going on in your mouth? What's growing in there? To show them the detriment and also relate it to that what's going to cost them later on as compared to later, and as opposed to now. So there's a lot that goes into. I have a lot in my toolbox, I call it, when I know what to say and how to say it to people when it comes down to selling health. But for me, it's a passion. For some reason, I've always been in healthcare. I found healthcare found me a long time ago, and I've always maintained the health and wellness, and I've taught it, I was a personal trainer back in the day. Out of college, I got into health and fitness in school. I was a competitive natural bodybuilder back in the day, and I still train 5 days a week. I eat a healthy lifestyle. I keep myself, how do I stay this kind of physical specimen? At my age, my advanced age, I look pretty good for 70, right? I always tell people that now. If I say to younger, they go, oh, yeah, I can see that. Because now I say I'm 70. But the point is, you have to work on it. And I thank God I learned the value of my health and doing this kind of stuff a long time ago. And I had dentists that I went to that, it took me until about 30 years old to come into a dentist who truthfully sold me on the importance of dentistry and spending money on it. And to this day that I will, because I got the big idea, the light bulb went off, so I'll spend on it. So I don't spend money on tons of money into dental insurance, I invested other ways in a dental, like I'll buy a healthcare plan. Even the dentist I go to has an in-office plan, which is also part of selling, rather than going through insurances. Why give insurance company? We can get a better doing in-office plans. Maybe this will be a different episode, how to do all this.
I think it will be another episode for sure.
but again, it takes an entire fight because how does a sales think about this for a second when it comes right down to it? This is a typical sales system in a dental practice, right? You have a person at the front desk who's pretty capable of talking money, right, with a person, right? So let's call her Jennifer. There's always going to be a Jennifer in dental office, right? For sure, for some reason. It must be the most popular name in dentistry that I've encountered, all right? But let's call her Jen. Jen's at the front desk, right? And so what happens in most sales systems consists of the doctor has a patient in the chair. He tells the patient, you need X number of crowns, you need this, that, and the other thing. And he walks over to Jen and says, Jen, here you go. Okay, and Jen takes them into a room, locks the door, and whoever emerges victorious in 30 minutes is the winner. And sometimes it's Jen. Remarkably, it's like a cage match. They're inside thing and they're going at it back and forth. And she's got to run back and forth to the doctor multiple times, ask questions and everything else back and forth. And it's like wheeling and dealing in a big fight to get the person on board. Okay, that shows you if it's personality-driven sales system. Like if it's all in the hands of a treatment coordinator to get a hold of this patient, right, and close them on something, right? We blew it earlier, right? By the time they get to the Jennifer at the front, it should be like, okay, how do I work this out? Okay, it's like it's the patient. When you always win, I always say, when it's the patient it's you and the patient. You and the patient's wallet against the patient, you win. Okay, if it's a patient and they're wild against you, you lose. It's 2-on-1. Okay, so if they're on your side with doing the product, they're going to go for it. Right? If they're like, how do we work this out? We've had those situations before when it just goes real easy, they accept it, whatever. Those are rare, but for the most of the time, it's a battle when it gets to the end of the thing. So the training on that sale, having a sales system written out is critical. A step-by-step way that we're going to go around and handle patients, whether they're new patients, whether they're existing patients. Thank God for the existing patients, because in a general practitioner's office, the hygienist is the internal sales division of the practice. So a lot of selling, and a good hygienist, for those of you that are listening, okay, a good hygienist is filling your schedule with work all day, docs. That's what they're doing. You're making your sales life easy because they know what they're doing, and they can co-diagnose work, and they're proactive about it. So you can walk in the room and goes, yep, it's just confirmed, it's done, and you're filling your schedule with work all day. But that's also part of it too. What selling is going on in hygiene. And I go back again, I keep saying the dirty word. Every time I say the word sell, you almost like cringe, right? If I say right now, let me test you, if I say, Noah, sell dentistry, do negative or positive connotations come to mind?
Oh, I think that for everyone inside and outside the industry, it's a negative connotation. Yeah. But at the same time, as we mentioned, it's the reality of our current system that you have to sell if you're a dental professional.
Yeah. I mean, but the thing is, in the reason why it's connotations of words, right? So the word sell in America means what? Rip off, screw over, take advantage of, used car salesman. That's the definition of. That's what we think sales is, And I do a lot of writing and research on words. Origins of words are very interesting. But for instance, in ancient China, that symbol for sell means to assist, aid, and support someone getting something they really need to get. That's not a bad thing, right? Because that's all selling was, right? And that's what it really should be. It's not ripping off a screw and taking advantage of. There's unethical people out there. We think we're going to be like, man, we heard horror stories about this doctor who lost his license because he did this. Yeah, but they're unethical. Okay, if you're doing it ethically and honestly, there's nothing wrong with selling people on getting well. And I think the operating mentality should be in any dental practice. For those of you that are listening that are doubting a little bit about what you're doing out there or presenting treatment or whatever. You have to have the true belief that the best thing a patient could do is spend money in my practice. That's the thing. That's the attitude you should go at when you're talking to a patient. It should come from a place of, you know what, the best thing this patient could do is spend money here, right? Because they're not spending it here where they are spending. Where are they spending it? What's going to happen, right? Yeah, they're going to go down. They're going to go spend it someplace else or sold them better than you, or they're going to go spend it at a hospital down the road when something really goes wrong on them down the road, right? Or some other major, an oral surgeon when something really goes bad, right? So that should be the operative mentality. So much of this is a mental game, right? This is why we're doing this coaching.
Yep.
Right.
Now you talked a little bit about different members of the team, and do the different team members have different parts to play in this, or should it be somewhat interchangeable where everyone knows kind of the playbook and can pick it up from whichever part they come in on?
Yeah, that's a great question. I mean, look, for me, there has to be a team-wide understanding of how the whole process is going to go. So they each play a little role. Everybody plays a content. The assistant plays a little bit of role, and they're doing their little part of selling, and the hygienist and the doctor, the treatment coordinator, they're all in it together. Some degree or another, right? They can all break the process throughout. So everybody should know what the other one's doing. They may not be the actual, let's say the assistant of the actual closer when she's sitting down and closing the money. Well, how many times, here's a scenario, docs for you, okay, this has happened. You're in a room, you're presenting treatment to a patient, patient's nodding in agreement, sounds good, whatever. You walk out of the room, the patient does one of these, see the coast is clear, and they lean over to the assistant and go, I think I should do this? It's like all your dental knowledge just went out the window at that moment. It's all hinging on what the assistant says. And if the assistant says, I don't know, okay, it's over. It's done. But if the assistant says something like, you know what, I've seen Dr. Smith do so many of these. You're gonna love the way you look. It's the best way to go about doing it, especially for your mouth. From what I've seen, you're in the right place. Sold, okay? Because it came from her and not the doctor, and sometimes what other people say about you is much more powerful than you can say about yourself, so it's good to have an assistant that's like that. She's helping close cases just like that, and it happens all the time. in dental practice. They're looking for opinions, right? Don't we do this on Google? I mean, we're an opinion society. We go, okay, what does people think about this? But you go on Google, right? And you listen, you read everybody's opinion on Google about everything. And we don't even know who these people are. They can be, who knows if it's accurate or whatever, but we take it as gospel 88% of the time, which is nuts, okay? So in your own office, your team's all got to be on board with the big end game, which is like, we got to close cases. We got to get people on board here. And because this is what we're all about. We're here to get sick people well and prevent the well from getting sick in abundance. That's what we're here about doing. So let's not forget why we're here. We're not a treatment center. That's how it gets into. We get in this mode of like, okay, we have people to treat. We'll just keep doing dentistry all day and crank it out. Look, what's the big picture behind what we're doing here, right? And that's why it's so important, that we all know the practice standard of care. Do I have time to talk about standard of care? How are we running on time today? No, I see you looking at the clock.
Yeah, we're getting closer to needing to wrap it up, but I got a couple little other, kind of angles on this I'd love to pick your brain out. Two things, and they both kind of involve hygienists. One, hygienists tend to be the person in the practice with the best relationship with your patients. If they're a regular, ongoing patient at your practice, they're going to spend way more time with the hygienist. I know my hygienist far better than I know my dentist. And I like my dental practice, but a lot of it is because I like my hygienist. So if they have that relationship, how do you best bring that into play to use them to help get patients to that yes?
Right. So again, I'm going to use this word again. It's having a system. Okay. For example, I have a hygiene system that we teach all our hygienists on in my program. It's about 15 steps. And if I showed it, if I did a screen share and showed it to people, they go, oh, wow, that looks pretty familiar. And you'd go through it and see that, yeah, my hygienist does that. She does, she doesn't do that. No, she doesn't do that. That's not part of her. Oh, she doesn't ask these questions. It's designed over the course of an hour. And I teach oral hygiene or 50 minutes minimum, to get into. You're not getting this system in place. Anybody can clean teeth in, an adult in 25, 30 minutes or so. But you're leaving out all the other all the education and selling if you don't have time to do this. Because a lot of doctors are reluctant to give hygienists more time because what are they doing with that time? It's a waste of time. They're not making me money unless they're scraping teeth. So we cram in as many hygiene appointments in an hour as possible. We're missing the boat, right? Especially if you're a clinic, you have to do it that way because you've got to do volume to make ends meet. But if you're just a straight general practitioner in a private practice, you need your hygienist to have time. If she's trained to do this properly. All right. And the system's about 15 steps. And if you look at it, you're going to see there's different points throughout the whole process that she is selling and through co-diagnosing a worker, educating a patient about what needs to be done. And she's doing this because she understands your standard of care, which is what I started talking about before this question, right? Mm-hmm. There has to be a practice understanding of what the standard of care in the practice is, right? Everybody's standard of care is different. I'm not telling you what your standard of care should be. Some people have a very high standard of care. Some people have a lower standard of care. Like a hygienist would say, some would say, well, I want all ones and twos in there and when I'm probing and perfect. And some would say, and a couple of 3s and 4s are no big deal. Maybe a little bleeding here, no big deal. It all depends on what your standard of care is for soft tissue and hard tissue management. But once you lay down the law of what this is my standard of care is, you expect the team to sell your standard of care. Okay, that's what I was. So if your standard of care is up here, very high, the bar on my camera here helping me is high. Okay, then you don't start in the middle and end up down here. Okay, that's the thing because you're always going to end up lower. So you're going to shoot for optimum, comprehensive, and then you can always settle lower. But you always want to sell your standard of care, and we all need to know what that is. So it can't be up in your head because all docs have a standard of care. When you look at a mouth and say, okay, that tooth needs a crown because it meets XYZ criteria. At this point, because this much of the tooth is gone or whatever, and then it has to be restored. And that's about as much clinical as I know. Me talking right there. That's you skewed me into a clinical conversation. If I don't know anything clinical, as I said before, that's all part of your standard of care. So the hygienist doesn't have to ask. She can say, what, based on what I'm seeing here, you put the intraoral cameras up. Because seeing is believing. The pictures, we use those cameras. You can increase sales by 20% using the camera and everybody in there, whether they're in good shape or not. And as a basic comparison for later, that camera's killer in there, and it shows it. So based on what the doctor's standard of care is and what I've seen here, and looking at this tooth, you see this here, he's probably going to come in and recommend, or she's probably going to come in and recommend a crown. And all you got to do is walk in the door when it's time, and the conversation takes place in front of the patient. And this is part of our systems because speaking in front of a patient is very powerful, right? because it duplicates them. They get the end that you got them and say, look, Doc, I just had a conversation with Noah, and he understands that this is probably going to need a crown. I recommend take a look. Oh yes, yes, Melanie, you're right. This crown, this tooth's got to be done. Sold. That's the thing. That's how it goes. So there is a whole system behind, right? Selling, and there's many elements to that. And a hygienist is one of the top person internally in your practice to do that.
Mm-hmm. And the other hygienic question that I'd love to get into a little bit has to do a little bit more directly with selling. A lot of practices, when they bring on a new technology or a new service that can be handled by hygienists, it might not be covered directly under the insurance codes, so they have an upcharge for it. And the hygienist is tasked with pitching it to every patient to try to get them on board with it. Personally, I always make sure my hygienist, even though she knows what I do and knows that I know about everything she's doing really well, I always say, please give me the pitch that you give to everyone. I want to hear how you present this service, this product to patients. I want to, learn from what you're doing. And I'm curious, do you feel like this is a good practice? Is that an appropriate thing to put on hygienists, giving them that kind of sales pitch role when it comes to these auxiliary services?
Look, if you truly believe in them, like whether it was oral cancer screenings one, right?
Yes,
there's the Velscope for different things. I mean, there's different tools for different. It's whatever you truly believe is best for the patient. You're not just doing it. If you're doing it just for an upcharge, whatever, then you're doing it for the wrong reasons. If you're doing it because you really truly believe this person needs to be screened for maybe apnea or a night guard or maybe some elective work, broach subjects about, I don't know if you noticed this, but your teeth shade, and let me do a comparison. You really whitening might make you feel better as you smile. But you don't have to push and make them do it. But I never thought about that. Give them some basis of comparison. You give them the options, right? But you create value. See, people, buy and they don't buy unless if they don't find it valuable, whether it's $500 or $5. Okay, upcharge. They're not going to spend the money unless they see the value, right, in doing that, right? We all impulse buy all the time, buy stuff all the time because we just find the value and we'll just buy it. It doesn't take much to sell us on that kind of thing, but that goes back to creating the value and demonstrating the value. Show them the value. Why is this important to me? Okay, this would be important to you. Let me explain to you why. Right? See, or let me show you why. See, the mind works on why. Okay, if you give it a good why, it'll do it. Okay, well, you say, because the doctor told me to tell you this. That's not a really good why. Okay, but the doctor really has a quota to meet, or something like that. That's not going to go over too well. Okay, that can't be the why. The why has got to be, hey, look, let's say it's oral cancer. You read them the statistics, and the dangers of this whole thing, and it's worth the check. Especially with your history, and you were a past smoker or whatever it is, and you go in and go with the data. Hygienists were on the big kick many years ago. When periodontal disease, the link to periodontal disease and heart disease and other health questions. What happened to that? That should be part of every conversation you're having in your practice if you have hygiene in there. And that's where your soft tissue management conversation comes in, and adding that. Not all cleanings are the same. And if you're going to do a deeper cleaning and a more intensive cleaning, explain to them why. In layman's terms, they understand. They don't know. They don't understand why. I don't understand why all cleanings are the same. They don't get it. So a lot of this has to be dumbed down to a 6th grade level with people when it comes to dentistry. We take it for granted because we live in that universe. Everything is just this makes sense. Start talking about MOs and DOs and TIVOs, whatever. They all say that's what it sounds like to a patient. They don't understand, what that all means. The mesial distal thing, we need a debridement. Who's getting divorced? They don't understand. This is normal terminology to us. We talk about like over their head, their eyes are glazing, their head's going back, and they're done. At this point, that you probably experienced it yourself. And people don't buy what they don't understand or confused about. You don't want to end up into that confusion by, introducing things they don't understand. That's why it's so important how you educate. I hear doctors tell me all the time, Doc, I can't close. Well, you have to educate. I do educate my patients, and then I listen to them speak and do a presentation, and it might as well be like to 4th-year dental students, that's in there. It's 4 years, right? Dental school 4 years now or 3, I haven't been around the dental schools in a while. I'm not sure. So I'm gonna get slammed. We're gonna get mail in. How does this guy be a consultant? I'm gonna use dental school. Let me take care of you after you're out of dental school, right? Whatever your dental is, if you're in the final year of dental school, that's what it sounds like. It's like that advanced, when you start talking. And it may sound great to one of your colleagues, but it doesn't sound great to the patient. It's not about how smart you are, right? Would you rather prove how smart you are, or be able to close the case and get people under treatment that really need to get it, right? Does that make sense?
Yep. And I guess that really does seem like it ties right back to what you said before about having the whole practice understand the standard of care that you're going to provide and how to talk about that standard with the patients who you see.
Yeah. And the thing is, we've said this many times before, having the staff on board. These are not employees, right? And I named my original company Staff Driven Dental for a reason, and the offshoot of Coaching on Demand, because it's about the staff, and they have to really buy into the big picture here. Like, what are we here for every day? What are you all about, Doc? Why do we do this? What setting expectations when you go into the thing? Have them understand why you're presenting Shiba in this way, or why you're going about it this way, or why are you so vehemently, into this, whatever it is. If you don't get them on board, if we can remember, the opposite of agree is disagree, all right? And if they have disagreement, the way you run your business and the way you do things, they think like, well, he's just all about the money. That's all he cares about is the money, or she cares about only the money, right? That's not a good place for them to be operating every day, because every time that situation comes up, it's in the back of their head, that this person's all about money, and they have to understand it's not about money. Okay? It's about my purpose to help people, get people well, and if we don't get them and commit them here, what's going to happen? Where are they going to go? Right. So that's why it's so important taking the time, to sit with them and put this stuff in. And a lot of times we don't do this because we don't know what to do. We don't know where do I find this sales system here, right? And look, you can go online, and that's the beauty and the curse of the internet. Everything's out there. It is volumes of information. The question, even my curriculum somewhere floating around the internet, I'm sure. Okay, but if I showed you my book and I just dumped my sales system in front of you, which is like 50 pages of material, or probably whatever it is, one of the biggest things we got, you'd be like, well, that sounds great, but how do I make this work in my particular practice or my particular staff in this particular town or this particular, there's all these variables that pop in your head, and we just go into apathy and we don't bother doing it, at this point, right? So it's so important to get coaching to learn, first of all, what's going to work best for your practice. Because every practice, there's no cookie cutter way to sell dentistry. I love these courses. Learn how to sell millions of dollars in dentistry. Yeah, says who? Right? That may be good for some people, or maybe natural for some people to follow that one way, miracle way you think you're doing it. But I've dealt with human beings for a long time, Noah, and I can tell you, there's no unified, universal way, one way you can sell anybody anything. Especially when it comes to dentistry, right? You just have to be able to, have a core system, right? And adjust on the fly with who you're dealing with, who's in front of you, right? Driven by, purpose-driven selling. Like this is what, and the desire to get people under care, because it's the best thing for them, but again, your staff's got to feel that way. Your team, right? You don't want to have employees that are just workers. You want team players that are driving toward a common goal, and know that we cannot achieve our goals if we don't sell people into dentistry. And really, that's what's happening all the time in your practice, whether you want to admit it and acknowledge it or not. It's going on every day. Every minute of the day, sales are happening or not happening. And I'm telling you, one of the things you don't want to fade less as we're winding down here in the episode. Okay, I'm watching the timer. Mm-hmm. is unselling treatment. So the worst fatal mistake I see all the time is we unsell because we're either talking too much, or we're the front desk has got it, someone else has got it sold, and the doctor gets a hold of it and he unsells the thing for some reason. Like, what are you doing? Person was in, and now you're unselling him, giving him 40 different options, or whatever it may be. Right? You don't have to give 40 people 40 different options. By the way, you can't say, "Hey, this is the only way of doing this," then you have legality problems. You can say, "There's a couple different ways of going about this." Right? But I'm going to tell you what's optimum, best possible for you. And then they can always settle for lower. But let's start with this. See, that's a different approach. But again, it goes back to training.
Mm-hmm. Well, obviously this is a deep topic, but we have flown through another 30 minutes today. I'm going to do this wrap up pretty quick because we are just about out of time. But if you have challenges that your practice is facing, you can email either of us. Our contact information is below. If you want to check out Coaching on Demand, there's a promo code as well on the screen for our audience to check out Coaching on Demand. Get in touch with Mike. He can help you with all sorts of things in your practice. Bring your questions to me. We'd be happy to deal with them in a future episode. Mike, this was a lot of fun as always. Thanks again, and we'll catch up with you again soon.
My pleasure. And like I said, I'm always welcome to give a month free to your listeners. That's the code's there. And send us your problems. Let us know. We could feature your problem on an upcoming episode of our show, and I'll troubleshoot it for you.
Wonderful. Well, we'll catch you all on the next episode.